Santa Cruz County attracts people from all over to soak in its beauty. The Pajaro Valley sustains some of the richest farmland in the world, highlighting the county's abundance. Our natural resources are on stunning display each day, but less visible are the residents of this county who struggle to make ends meet. Behind the scenes, there is a safety net of clinics for individuals and families who don't have access to health care. The safety net clinics provide high-quality care to anyone who needs it, regardless of ability to pay. Here are the stories of how the clinics, despite mounting budget challenges, work creatively to provide quality health care to the community's most vulnerable residents. Together, the Safety Net clinics strengthen our community by providing the access to health care that all residents need and deserve.
Santa Cruz County really needs safety net clinics because in this world and in this economy, there aren't enough healthcare resources to go around, and we really just need to bolster those safety net clinics that we do have to make sure people aren't falling through the cracks, make sure people aren't just living with chronic diseases that aren't being managed and ending up in the ER when it's really too late to do much about it.
I think the most important mission is that we provide access and a medical home to the underinsured and the non-insured who, if it weren't for clinics like ours, would not have access to health care. And more importantly, not just access, but a medical home.
My husband had a stroke about 3 years ago, and we lost pretty much all of our insurance, and I didn't know what to do. So I came in, and at first I was a little like, you know, what's happening? I'm in a clinic. The sterile environment that I was expecting of a clinic just melted away once, you know, I saw what they did for the kids. And Dientes came to my rescue. It's here for me in an affordable way where I can make sure that my children stay healthy. Because dental health is medical health. I mean, it's not just pretty teeth, it's, you know, the health of your body. And so it was a choice that I had to make, and I'm just fortunate enough that it's here.
When a patient comes in with, you know, extensive dental needs, and when they leave, they literally look 20 years younger sometimes. It's phenomenal. It can dramatically transform that person's appearance. It's really quite phenomenal, and really the picture is worth 1,000 words on that one. And we hold ourselves to the highest standard.
We went from, you know, having a very, you know, easy life. You know, my husband was a software engineer, and it went from that to nothing. And it was very scary, and I didn't know which way to turn. And having this available, it's absolutely incredible. I could not be happier.
The community health worker Promotora model really stood out as a proven, well-accepted, time-tested approach. So by using Promotoris, we can get people in the community, helping other people in the community better translate the recommendations that their healthcare providers make for them into something they can actually do and understand what they're doing. So we do things like come out and screen for blood sugar and blood pressure, not because we think that in itself is important, but because that's a way for us to communicate with people about their options in the healthcare system and things they could do to access the healthcare system.
So I came back here and I saw Dr. Hendricks, and she really helped me a lot. I mean, even a lot of times I'd go to the hospital and I'd tell my husband, you know, go by the clinic and let her know that I was there and what was going on, and she would already know because of the computer.
Our most difficult population is often going between the emergency room and back to the Emmeline clinic. So there is a lot of coordination and flow of care. Our patients aren't always so easy to follow up on. Some don't follow through on their own care, and that is part of my job, is to try and get that care to happen when they're in front of me. And I think we're doing better and better at coordinating with each other to get those records back and forth, and it just makes that so much more efficient. I used to get paper charts with little sticky notes stuck to the top that said some vague information about the question that a patient had to ask.
The second most common reason that we have blindness in this country after trauma is because of diabetes. So it's a serious thing that we check all diabetics, regardless of their ability to pay for these eye diseases, that we can actually treat and try and avoid blindness in our patients.
I always wanted to work with minority groups because I know that it's very hard to find a doctor who speaks your language and understands your culture, and how hard it is to maintain that communication. Every diabetic patient, we do a comprehensive eye exam and take the retinal pictures just so that I'm able to compare what they look like today versus 3 months, 6 months, and so on.
And we can actually have results of a retinal eye exam done the same day, sometimes in 20 minutes, with either an optometrist or an ophthalmologist reading the patient's photographs that are sent via computer to UC Berkeley.
It's a wonderful experience to have a patient who actually allows us to follow us close and notice that there can be no diabetic changes in someone who controls their glucose levels.
We're proud of where we're at specifically in this community and where we'll be in the next 10 years.
I see hope in the fact that people care about each other, and that those commitments to each other and the commitments to their communities is still there regardless of budget cuts.
Salud para la Gente provides a very important service, especially for those of us Hispanics who don't speak any English.
We thought of that as good quality care, but also an issue of social justice.
It's like talking to a friend almost, except for he's your dentist.
She's been my doctor, my friend, my pal. I wouldn't go to the doctor if it wasn't for her.
For years, local safety net clinics have stretched resources to meet ever-increasing demand. The clinics draw on complicated streams of public funding and even private fundraising in order to make ends meet. When budgets don't stretch far enough and vulnerable members of the community go without health care, the cost in human terms is immeasurable. This price is then paid by the entire community in the form of higher healthcare costs, overwhelmed emergency rooms, and financial pressures on the whole healthcare system. It's important to shed light on the vital role of Santa Cruz County's safety net clinics. Nearly as invisible as the clients they serve, the safety net clinics are critical to ensuring the strength and health of our entire community.